Hi, and welcome to the show, Dr. Corine Ferebee. How are you today?
I am great. Thank you for having me.
Yeah, how's it going down there in
It
Atlanta?
is super rainy today, but we are like, if we can just, it's not that we have anywhere to go. So I guess
Yeah,
we'll be okay.
yeah. But is the situation okay with the whole corona outbreak?
Oh, it's crazy. Everyone's
Yeah,
in a panic, but at the same time, getting people to like follow the restrictions that have been placed on us is hard. So
yeah.
I think they're going to get stricter in what they're requiring of people because people.
Yeah, I mean, we've been hit really hard here in New York, but I understand it's not as bad, down in the south when the weather is warmer. Is that the case?
Yeah, definitely the numbers are much higher up north. But we are still seeing new cases and we are still seeing deaths. So
Yeah, yeah, definitely. Better safe than sorry. So this quarantine thing, just take it for what it is. Be safe, keep your family safe, stay indoors for now.
yeah, just stay indoors.
I mean, you can go outdoors, just social distancing, just maintain some distance
Exactly.
and wash your hands. That's very important.
Yes,
Yeah.
absolutely.
All right, so let's go ahead and start the interview. I understand you are a pharmacy leader, entrepreneur, health and wellness consultant, and just do a ton of things. So why don't you just introduce where you grew up, where you went to pharmacy school, and how you kind of just came to be this kind of a pharmacist?
Yeah. So I am a Southern girl, born and raised in Georgia, actually Augusta, Georgia. So I pretty much have always known that I wanted to be a pharmacist. I was very intrigued with medicine and how it cures people. And so once I decided to go to pharmacy school, I actually went and got an undergraduate in microbiology, and then I applied to pharmacy school and I went to Xavier University in Louisiana.
Cool.
And so when I came out, well, the entire time that I worked in pharmacy school, I always worked in the retail sector. So when I graduated, I just assumed that's what I would be doing. And so I got a job in retail, and I had this pharmacist mentor that said, hey, you're great at retail, but if it's anything else you want to explore, this is the time to do it. Like, go and do it now. And so I started looking at some other things, and I spent a little bit of time in long term care. And then I was offered an opportunity to be a pharmacy director at a small clinic. And so I took that, and I really, really loved doing that because not only did it give me more one on one time with my patients, but I felt like I was able to take care of the entire patient, because we made sure they had the medication they needed. We looked at their finances. We were able to dig a little bit deeper and see, why are you suffering with diabetes, and what does your household look like? Does anybody else have diabetes? Those type of things. So
Mhm.
I really love that position. Eventually they started to have some financial issues, and so I ended up back in retail. And retail was so different,
Yeah.
because at that point it was like 10 years later, and retail had changed so much. It was just all about the numbers. How many patients can you talk to, how many patients medications can you get ready, but it was no, like, really, like, being able to have the real conversations with the patient. And that just really kind of like concerned me.
Yeah.
So about 3 years ago, I was diagnosed with lupus. And so I said, something has to change because number one, I felt like I could no longer work the 13-hour shifts and be on my feet for 13 hours a day, day after day after day. And then to be doing something that I felt like wasn't my true passion, it
Mhm.
was really hard to go to work every day. So I decided to create Trinity Wellness RX Consulting. And kind of how I came about it is I looked at, okay, what is it that I do enjoy doing every day when I come to work? And it was talking to the patients and trying to help them figure out an action plan to have better overall health, not just like treat that one disease but just to have good healthy lifestyle habits in general. And so I said, let me see how I can incorporate that not only into my own life at the time, because once again, I was diagnosed with lupus and I was put on all of this medication. And I said, this cannot be my life for the rest of my life.
Yeah.
And so I changed my eating habits. I started a consistent exercise plan. And then I looked at all the medications I was taking. And I said, I need to come off of these things. So with the nutrition and the exercise, I went from taking 14 tablets a day down to taking 2 tablets a day.
Wow.
Yeah,
wow.
exactly. And I was like, okay, if I could do that for myself, then I can help other people do that as well. And that's really the basis of what helped me to create the business, is because I wanted to help people. I wanted to empower them really to know that you can take control of your health and have a healthy lifestyle, and it will change the dynamics of all the things you're dealing with, especially as far as chronic illness. And so when I talk to my patients, that's what I talk about. I talk about nutrition, I talk about exercise, and we create programs so that you can live an overall healthy lifestyle.
Mm-hmm.
But ultimately, that's the goal.
Yeah, feel good, be healthy, and live your life.
Exactly.
Yeah, I totally hear you about retail because I still work in retail, so I am still there. It's a little different in independent pharmacies because we have more one-on-one time with consulting patients, but the business end of it is very hard to make ends meet because we don't have like the numbers and
Mm-hmm.
stuff. So definitely very difficult to stay afloat nowadays. So I think that's such a great goal to have, just to help people need less medications. And look at the time that we're in, all this crisis with medication back orders and shortages and supply breaks and supply chains. We're not meant to take 14 tablets a day. So we're meant to, thrive without the medications. The medications are an emergency safety net for when we do need it for short term. But for chronic illnesses, really, we should be able to take that medication burden off.
Absolutely. And like you said, like everything is always on back order. So the people are not getting what they need anyway, or they're having to change from one medication to another medication. But, we want to be able to empower people to have other options, because I do, cold-heartedly feel that if you eat right and you exercise and you reduce the stress level, and you give your body the nutrients and the things that it needs, you won't be on that much medication. You won't need it. A lot of times patients go to the doctor and they're diagnosed with different chronic illnesses, and it's almost like a death threat. It's because it's like, hey, you have high blood pressure or you have diabetes, and they make it seem like that's for life. And it doesn't necessarily have to be like that. You can, our hopes is that you'll take control of that before that happens. But even once it happens, I just feel like you can reverse that, with the proper guidance and nutrition.
Yeah. I mean, if you do have, let's say, diabetes or pre-diabetes or hypertension or pre-hypertension, that puts you at a high risk, and you will have to monitor yourself for the rest of your life, and you monitor those levels, but you don't necessarily have to be tied to taking medications day in and day out.
Absolutely.
Yeah, that's a great point. So is that what the Trinity part stands for? Is it nutrition, exercise, and stress, or is it something else?
It's nutrition, exercise, and then medication therapy
Medication.
management. So We still want to educate people on medication and make sure they understand why they take it, especially in our elderly population, because a lot of times I see they'll say, oh, I take 5 medications, but they don't really know what the 5 medications are. They know they take a red tablet, a blue tablet, a yellow tablet, but they don't really understand the importance of why they're taking it and, what it does for them. So we do want the ones that are on medication to understand the medication and the purpose.
Yeah, and understand which ones you definitely need to take on schedule, which ones is only like PRN as needed for what
Exactly.
it's for, so they know do they need to take it or not.
Right.
Yeah.
And be okay with not needing. We patients go to the doctor all the time and they'll get put on, like, let's say, like a reflux medication.
Common.
And they just think that's part of their normal regimen for the rest of their life. Like, they feel like they can't live without it. And, it's things we can do, especially within our diet, that will change the need for that. So we just really want them to understand the medication and why they're taking it and if they even need it.
Yeah. And also lifestyle, like if they're lying down, reclining right after a meal, there you go. That acid, that's digesting their food is coming back up. So, and
Exactly.
the bed can also be on an incline, so to help that reflux from coming up. So there's a lot of things outside of food that we can also consider as their lifestyle choices and habits.
Absolutely. And that's kind of where we come into play, because a lot of times doctors don't have the time to go into detail. They just want to treat the symptom, which is what you went to the doctor for, to get rid of this symptom. And so they give you the medication to get rid of that symptom, but as pharmacists, I hope that we can come in and do a little bit more education, to help patients really understand what's going on.
Yeah, unfortunately, that's exactly right. Doctors don't have the time or the resources or the staff, to go and educate the patients. And as pharmacists, sometimes we are in this little ethical dilemma where our business numbers are dictating towards how many medications we fill and sell.
Mm-hmm.
But as educators and healthcare practitioners, we are taught non-pharmacological approaches first, and we do try to educate the patient so they won't need to rely on those crutches and those band-aids that just cover and mask things. And we
Right.
do need to do the detective work. And it's awesome to get paid for that too, because we're taking the burden from the patient and improving their quality of life.
Right.
Yeah.
Right. And then you form that trust, because then they'll come to you, when they do have concerns or questions, about things that are going on in their life. And that's how you end up taking care of the whole patient, and that's my goal, is to be able to be a resource for whatever they need.
Yeah. So how does your company function currently? Do you do one-on-one client consultations? Do you do any kind of teaching or group setting classes?
So it has changed, especially over the last couple of weeks. But originally, when I started out, I did one-on-one or small group in the gym setting, as well as virtual. So in the recent weeks, which I was already moving in that direction anyway, but in the recent weeks, it's become 100% virtual.
Yeah.
So, but I mean, technology is amazing. So it still allows you to really do the same thing. I thought it was going to be a challenge, or it was just going to feel differently. But with the technology that's out there, I'm still able to do one-on-one. I'm still able to do virtual coaching. And I'm able to reach more people. So I'm loving it. I'm
Yeah,
loving
it's great. It's such
it.
a benefit. I mean, you don't have that one-on-one in person, like, I don't know, this personal touch to it perhaps, but it still works, like you still do sit face to face and you could still do the same coaching techniques from a distance.
Yeah, yeah. My biggest concern, especially as far as the exercise piece, was being able to adjust what they were doing to make sure that they were doing the exercises correctly so that they could get the full benefit. And with virtual, you still can do that, so you get to see exactly what they're doing and how they're doing it and say, okay, let's adjust this, so you can get the full benefit. But it's working, it's working out good. And like I say, I'm able to reach more people
Yeah.
versus what I was doing before.
Perfect. Yeah, because it saves you time in commuting, and you can do like a live Zoom call or a webinar with more people.
Oh yeah.
Yeah, that's great. So were you able to transition full time to this consulting role, or do you still have other jobs on the side?
So a little bit of both. So when I first started the business, I was still working full time in retail.
Mm-hmm.
And then I made a decision. I was like, okay, either I'm going to have to step down and work part time, or I'm going to have to leave completely.
Yeah.
And so at the time, there wasn't a position, a part time position. So it kind of forced my hand to make a decision, to leave. And so I did, and I prepared, in the process. So I saved money, so I knew like 6 months out that I was leaving. I set a date and I prepared. And so once I left, I was working on my business full time for about 6 months. And then recently I have a friend who owns an independent pharmacy. And so I pick up PRN there. I'll do like 1 day a week, but nothing. I made a commitment not to do anything that takes more time than me working on my business. Like that has to be priority. So
Great, great. So, how did you educate yourself on these, non-pharmacological approaches, diet and lifestyle and exercise regimens? Was it after you were diagnosed with lupus and you decided to do that, or was it all like during pharmacy school, after pharmacy school? Like, when did that happen?
I think it was a little bit of both. I think as pharmacists, we're educated in general on those things. Like, and I really believe the population in the world is educated on those things. It's really more of a mindset as to whether you do them or not. But I
Yeah,
think we all know we need to exercise. We all know we need to drink water, eat vegetables, like those things. We know those things already, but why we don't do them is more of a mindset thing.
yeah,
But even before pharmacy school, I enjoyed, exercising and working out and, being out in the world on the streets running. I enjoyed those things. So, but it helped me to understand the importance because when I went back to retail that second time, strenuous and I would be so exhausted that I no longer was able to do those things. It became really hard to add those things into my day to day. And, one of the things that I help people do is to strategize a plan so that you can incorporate those things in, regardless of what your schedule looks like.
nice. So did you have to take any other like nutrition or personal training courses to be able to implement it in your programs?
So it's not a requirement, but I did feel like it was important to me. So I, of course, did the medication therapy management certification. I am a certified personal trainer. I took a course on that as well. And then I take courses along the way. So recently I took advanced nutrition. And just as a reminder, because again, as a pharmacist, we get all of these things. It's not anything that we haven't been exposed to, but just like anything else, you want to stay abreast of anything that's new, that's coming out, and then just educating yourself about what's going on in the community. So, like if people are doing keto diets, you need to know what a keto diet is, because you're going to get questions about it all the time. And then you need to be able to educate them based on what they're dealing with individually, if that's a good a good route for them to choose.
Absolutely. That's such a good point. Like we have to take continuing education courses as pharmacists, as professionals, but same thing if you are involved in any kind of alternative or non-pharmacological treatment options, you should also keep afloat on anything new and all the new evidence-based studies that are coming out
Yes,
also.
yes, absolutely.
Yeah. So, all right. So you were able to mostly commit to full-time consultant work. How were you able to grow your business and get clients?
Your best friend is social media. And it's so funny because I really considered myself an introvert before I started my own company. And I was like, social media, I don't have time for it. I was one of those people who never posted anything. But after starting my business, I realized that social media is a must. That is how you reach people, regardless of whether you want to be on social media, everyone else is on social media. So you really have to use that platform. And it saves you money in the end of the day because you have to have some level of marketing regardless of what type of business you have. And so I have really taken advantage of social media. And then it's so many different levels to social media because you're posting, but then people also want to see you. They want to, because at the end of the day, they are, true enough, they're buying whatever product you have or whatever package you're selling, but they really want you. So you have to show up and present yourself, and social media is just a great way to do that.
So, which social media platforms are your go-tos?
I use them all really, but I use them in different ways because um I look at Facebook, and it's mostly like friends and family. So you can be a little more relaxed, and you can put funny videos, but yet still giving some type of education. I can put a lot of exercise videos there, as well as Instagram. Instagram, to me, it's a lot of people that you don't necessarily know, but that's a good thing because then you can reach people and let them know what it is that you do. So I feel like you can do a lot of marketing there as well, as far as, especially with the exercise piece of what I do. LinkedIn is supposed to be a little bit more professional. So I use that as more of an education tool. So I usually like to be able to teach somebody something, or, just give valuable advice. So it's not all fun and games. It's more professional. But yeah, I use them all. So, and the great thing about social media is you can take a video and put it one place and it goes everywhere.
That's right.
So
Recycle and repurpose.
absolutely, absolutely.
Did you have any business or marketing training along the way, or did you just kind of figure it all out on your own?
I wish I could say I figured it all out on my own. I didn't. So I was lucky to have a coach. She is a pharmacist, Jerika Dodd, and she started her own consultation business. And so she's done a lot of the things that we're trying to do. And the great thing about her is she doesn't want us to make the mistakes that she did.
Yeah,
So she says, hey, do this, because it works. I tried to do this and it didn't work. So don't waste your time, type of thing. But she has really given us step by step on how to get things done, from filing for an LLC, down to social media, down to what you should be saying, why you should be saying it, creating webinars. She's really given us the tools to be successful.
awesome, awesome. So is it just you right now running the business, or do you have any employees?
So it's just me, which can be good and bad, because I did try having some employees, not as far as being a pharmacist or a primary, educator in the business, but I felt like in the beginning, I felt like I needed help with the social media and, just like the administrative stuff.
Exactly. Yeah.
But you have to be very, very careful because everyone doesn't know your heart and they don't know your business. So even though anybody can go on and post for you, it may not necessarily be what you feel.
Mm-hmm,
So
mm-hmm.
you have to guard your business very, very carefully, So I decided to take those things back on. And so I pretty much do them all myself. Um, but I do have pharmacists that are reaching out that want to be a part of what I'm doing. So, that may change in the near future. We'll see. But right now, it's just me.
Awesome, awesome. Yeah, I understand what you're saying about the social media presence. Like you want to still portray and demonstrate your own voice, and it's very difficult for somebody else to take that on and to like
Yeah,
speak with your voice.
absolutely.
Yeah. Yeah, I often think about that myself because that's like the most daunting part of the business for me, like marketing and, being present on social media. But that's such a good point, that not everybody can have your copy and your writing and your voice and your style.
Yeah, nobody's going to be as passionate about what you do as you are,
Yeah.
you
So
know?
what, besides maybe expanding to other caregivers, what are the plans? What is the current goal and vision and like maybe like a 5-year goal for your company?
Yeah. So currently, I just want to reach as many people as I can. I want them to, know who I am, know what it is that I'm offering. And if I could be of assistance to them, I want to be able to do that. And in the process, I'm just like critiquing what it is I do and what it is I offer, and being flexible. That's probably some of the biggest things that I'm working on currently. In the future, I would definitely like to expand the business, have more caregivers, be able to reach more people. And then I am actually looking into possibly doing like retreats so that we can bring people together and show, not only just tell them things, but show them things. So, because, we talk about nutrition, we talk about exercise, we talk about medication therapy management, but there are other things that are included in those lifestyles. So you might talk about yoga, you might talk about bringing a herbalist, so it's just other things that you can add to the mix to educate people.
Yeah, that's such a good point. I mean, if you plan to do it in the coming months, you might have to do a virtual one. But
Right.
I really like having both options because the in-person ones are usually more expensive. You have to take time out, you have to travel,
Mm-hmm.
all that adds up. So you could do both because I think the in-person ones are just so special, and you
Yeah.
do have that personal touch and like you're able to use all your senses like when you're learning. So that's just really special, but not everybody may have like the means or the time, with their
Right.
responsibilities to family and whatnot to do so.
Yeah, and I think in the wake of everything that's happening with this pandemic, I think it's allowed us to think outside of the box and have other options. Because a couple of years ago we wouldn't have thought of doing any type of retreat virtually.
Right, right,
But now that's an option. And people are open to it. So I think we are going to have to adjust our businesses
right.
because many of the things that's happening has caused us to look at things differently, offer more, virtual programming. And I think that's here to stay.
Yeah.
So, yeah.
So, what is your overall mission with your company? And maybe if you could even do like an ideal world version of our perfect healthcare system, like, what would
Ooh.
that look like?
So, my personal mission is just to help people to prioritize themselves. Many times, even with me, with the lupus, I was experiencing symptoms really for like the last 10 years. But I would just work and work and work and say, oh, I'll take care of it later. I'll eat better tomorrow. Oh, I'll exercise next week.
Mhm.
And then it doesn't happen, But I feel like if we prioritize ourselves, then we automatically prioritize our health. And then we end up with healthier lifestyles in general.
Can I just ask, for people that may not know exactly how severe lupus is, it's a very debilitating whole body autoimmune condition. Can you just describe some of those beginning symptoms versus maybe some other things that you had to overcome?
Oh yeah. So so it started out small, like right a couple years after pharmacy school, I would um I would have my joints would ache. So I would have pain in my joints. I would have acne. I had the butterfly rash that people get. I had the shedding of the hair. And then I would just be extremely, extremely exhausted.
Yeah.
And unfortunately, I would go to the doctor and they would give me excuses as to why I was experiencing certain things. It was like, oh, you work all the time. That's why you're exhausted.
Right.
Or you're on your feet all the time. That's why your joints hurt. And even down to the acne and the shedding of the hair, it was, hey, you're stressed out. Pharmacy school was stressful, and it's just now showing up. So again, we have to prioritize ourselves. When something isn't right with you, you have to keep going until you get the answers that you need. And so I didn't. I just said, hey, they're the experts,
Right.
so they must be right, and then those things just continue to get worse and worse and worse until one day I went to get out of the bed and I could barely walk. My body was just exhausted and it was just like, no, I'm done. Like, we have to figure this out. And so when I did get diagnosed with lupus, I not only had lupus, but I had lupus nephritis. So it affected the kidneys. And they wanted to put me on dialysis. So I go from this perfectly healthy young lady who's running every day to now someone wants to put me on dialysis. And I was just like, no, I'm not having it. It has to be other options. And so that's what made me start to look into the things I looked into. And for me, it was taking meat off the table, it was reducing the sugar, and like I said, exercising. So yeah, it could have been much, much worse. But I had to think quickly and make some decisions and some major lifestyle decisions.
Wow. Thank you for sharing.
Oh, absolutely. But as far as what I would like a perfect healthcare system to be, I don't know if there's really an answer for that. But what I do know is I would like to see healthcare pay for more than medication and going to the doctor. I would like to see other types of lifestyle things added into the healthcare system. So it would be amazing if we could, if healthcare would pay for things like yoga and meditation. I had the opportunity to experience this guy. He came into our clinic, random, came into our clinic, and he was like, "Hey, I'm a meditation specialist, and I can help save your patients' lives."
Wow.
And this was like maybe almost 10 years ago. So, of course, everyone was looking at him like, what? What are you talking about? And so he was like, look, just let me show you. And so we basically set up something, and he worked with 20 patients that had high blood pressure and 10 staff members that had high blood pressure.
Mm-hmm.
And the only thing he introduced into their life was meditation. He didn't change, their exercise, their nutrition, any of that. And all of their blood pressure numbers came down after 30 days.
Wow.
So, the American healthcare system needs to get on board because there are other things out there other than, and I'm a pharmacist, but there's other things out there other than just medication.
Yeah, absolutely. I think we need to have more of these scientifically rigorous studies, like clinical data for outcomes using some of these modalities. Because a lot of what we see is like, okay, medication X versus medication Y, and they're very similar in the first place. So
Mm-hmm.
instead of like more Me Too drugs, why don't we like figure out what works from what we already have, accessible to
Yeah.
us? Breath work, meditation, yoga, exercise,
Mm-hmm.
mindset rituals. Let's study that and let's pay for some of those outcomes.
Exactly. Exactly.
Yeah.
That would be amazing.
Yeah, a whole lot of restructuring, but at the end of the day, it's paying for services that health coaches or consultants or teachers would provide,
Mm-hmm.
and our health insurances could be put to that kind of a use with a lot less burden on our livers and kidneys, processing the medication
Exactly. Exactly.
and, less cost of labor producing the medications, less chances of back ordering,
Mm-hmm.
and just reserve that for people who really do need it.
Right. Exactly.
Yeah.
Exactly. And just being able to expose patients to other options. A lot of people don't even know that these other things exist.
Right.
Um, so they don't, and like you say, the healthcare system doesn't pay for them. So it's like, oh, I'm not going to take on another financial burden.
Right.
I'll just take the pills because my insurance pays for it. I'll just take
Absolutely.
it.
I see a lot of people thinking that way. And
Yeah.
people who don't have insurance actually will probably turn to herbs because herbs are a lot cheaper, especially if they're not in supplement form, but just like in the actual dried herb or tincture.
Yeah.
It's a lot more cost effective for someone who doesn't have insurance to go and, self treat with herbs rather than have somebody prescribe the medication and pay out
Mhm.
of pocket for the medication.
Yeah.
So it's a good alternative, but ignorance is not always bliss. So like the more that we know of what can help us and the more this is present in our healthcare education for providers and patients, like
Mhm.
the stronger that we can get.
Right. Right. We definitely have to keep educating, keep putting it out there.
All right. So we just have a few minutes left. If you don't mind, I have a few last minute rapid fire questions for you.
Okay.
All right. So what is your advice for students or other pharmacists that may be interested in a more integrative, holistic approach to providing pharmacy or consulting services?
I definitely think there is a need for that. And I think that we are going to have to create our own lane. So don't be scared to, get out there and use the tools and the knowledge that you have to educate people, whether that's through your own consultation business or, someone else's. But it's okay not to be traditional.
Yeah, awesome. I like that. Okay, what's the number one thing listeners can do right now to improve their quality of life?
To improve what?
Their quality of life.
Oh, exercise, exercise, exercise. But yeah, just like come up with a plan for yourself and do things one step at a time. I tell people don't try to like do it all at once and say, hey, I'm gonna eat right, I'm gonna exercise, I'm gonna sleep, like one step at a time. And then you master that. So you master going to bed and getting 7 to 8 hours of sleep, and then you add on something else, so let it be a gradual thing so that it'll be a forever thing.
Right, right. Make it sustainable. So make it a goal that's achievable and not an impossible goal.
Exactly.
What is the number one hobby or pastime of yours? I think I already know this, but
No, surprisingly. So probably like my thing that I do that I don't need to do is I love reality shows. So I watch reality TV. That's like when I want to just like relax and don't want to think about anything that's going on in the world. I
yeah.
watch reality TV, eat some popcorn, enjoy life.
Yeah, Netflix and chill.
Yes.
All right. And what is your favorite beverage to drink?
Water. Water. I used to be a Coke person. So I literally would drink Coke every day. But what I realized is that I was drinking Coke due to stress.
Mm.
So the minute that I removed stress from my life, when I left retail pharmacy, I haven't had a Coke since.
Yeah. Yeah, I could totally relate. Sometimes it doesn't even matter what it is. It's like you're reaching for something to put down your gullet because you just don't want to be present where you are. So like when
Exactly.
I'm home and like doing my own thing, I can not eat for hours and not even be hungry. But then like if I'm doing something I don't really want to do, I'm like, I need a snack, I need a drink,
Uh-huh.
I need this, I need that.
Yes.
It's like all these distractions.
Yes.
Good old H2O, best
Yes.
thing. Yeah, absolutely. So, lastly, I just want to thank you so much for your time and sharing your wisdom with our listeners. And please tell us how we can reach out to you and learn more about your work.
Yes, yes, thank you. I have really, really enjoyed today. So in order to find me, you can go to Dr. Corine Ferebee. That's Corine, last name Ferebee, Ferebe, as in boy, EE. You can find me there on Instagram, Facebook, and LinkedIn. So I hope that you guys will, find me, message me, connect. I would love to talk to you.
Awesome. So, I'll have all of that in our show notes so you guys can access it there. And again, thank you so much and enjoy the rest of your day and stay safe during this crisis that we're having.
Yes, you as well. Thank you so much.
Take care. Bye bye.
Bye bye.